Riverside Medical Center is a 325-bed medical center located in Kankakee, Illinois. We service approximately a 4-county area. We know as a nursing profession that washing your hands, which is such a basic thing that you can do to help prevent hospital-acquired infection and just provide excellent care, is such a simple thing, but it isn't always done.
Hand hygiene is a quality issue and one of our top priorities at Riverside Medical Center. One of the things with hand washing that is the easiest and a thing that we can do as staff in the hospital to prevent the spread of infection.
For a long time we struggled with various methods of trying to analyze our staff members being compliant. Are they cleaning their hands frequently enough? Are infectious rates where they need to be? Are they low enough for us? Are we happy with that? And we would try things like observation, and of course the Hawthorne effect would come into play, so people would behave differently when you were observing them, and that was very time consuming and very tricky.
We had several opportunities where other staff members did not feel that that data was credible, and it did rely on human elements that were unpredictable.
That method wasn't as effective as we thought it could be, so our challenge was to find a system that the staff would understand the data and agree with the data and also be able to be safe for our patients and staff.
And so how do we as an organization help engage that bedside nurse to understand the importance of it, and then also to not feel like they're being punished or that it's a punitive process, but that it's truly for that, that excellent patient care.
We're looking at trying to improve patient safety, not to have the negative effect on individual employees.
We wanted to be able to focus generally as the unit and be able to give data as the unit to be able to improve hand hygiene.
Some of the great advantages to having a group monitoring system are it becomes less personal. It is real-time data that we're able to access in the moment. I believe the system really puts us into the next level, being able to actually help teach and train our staff to be able to look at other opportunities besides just gelling in and gelling out.
There was always a lot of excuses, but with this, there's no excuses. There's no debating it, there's no disputing it. It is what it is. Either you're gelling properly and you're using the 5 moments or you're not. So we have a true method of measuring that and analyzing our own performance now.
Our numbers have almost doubled as far as the compliance within our overall hospital rate as it relates to hand hygiene, which are really some phenomenal numbers.
Prior to using the DebMed system, our hand hygiene compliance was at 32%, and since using the DebMed system, our hand hygiene compliance has risen to 62%.
The fact that we have bought into it from the administrative level down. I am very involved in hospital-acquired infections and making sure that we as an organization do whatever we can to work on maintaining a high level of quality and patient safety. And I believe that from engaging initially with the DebMed GMS system and supporting it from the top down, we've had better buy-in from the bedside nurse.
For the first time, I hear nurses encouraging families, visitors, and even the physicians to be sure they gel their hands. And we're finally aware of the importance of it and really holding each other accountable now.
So there really are 3 distinct advantages to the DebMed system. The first being patient quality and safety. The second, return on investment. And the third is that it truly is a less intrusive way for us as a hospital organization to monitor our hand hygiene compliance.